Hello, and thank you so much for your interest in my programs. My name is Katrina Sanders, and it is a true honor to have you looking through my speaker packet. I wanted to take the time to go over with you a few things for you to consider when you're looking through my courses. This little video is going to be a guide walking you through some of the details you may not necessarily see within my speaker packet. The oral systemic myth, bridging the medical and dental professions. This is a course that truly is designed to help educate particularly clinicians, although I do find that our front office team members, our administrators, our dental assistants also really love this content because it includes fun news you can use about the link between oral and subsequent systemic disease. Now, this is a bit of a provocative course because what it does is it begins to show dentistry the medical model. How do our medical colleagues walk through their process of care? How do they help their patients understand the level of disease that they're experiencing? And how do they ultimately motivate and inspire their patients to get involved or take ownership over their disease? This is going to help dentistry position themselves as the true specialists or extension of the medical community that we truly are. Now, this is a course that looks at how we can take a more active role in not only treating oral disease, but also discussing, screening, evaluating, potentially helping our patients come to a diagnosis and developing specialized plans around potential systemic diseases. This is an interesting course because it is in fact offered as a partial day lecture. It is also offered, or can be offered rather, alongside a collaborative physician. I have on many occasions co-presented this precise course alongside my sister, Dr. Elizabeth Sanders, who is a doctor of podiatric medicine and a faculty member with Boston Medical. Who doesn't love a good sister act, right? Especially when we start to bring a physician into the dental space. We found that this course does really well as either a partial day lecture or can be integrated as a morning lecture and afternoon workshop. I'll tell you one of the coolest aspects that I've seen when I've co-presented this alongside my sister. The afternoon workshop actually turns into a really immersive and highly engaged panel. My sister and I are constantly answering incredibly deep and very insightful questions that come from the audience, wanting to understand how they can involve themselves and participate in the oral and systemic link. It is truly an intimate experience and one that leaves participants feeling like they were truly engaged and a part of something amazing. I hope that you will consider bringing this to your meeting to truly elevate what it is that we can do for your participants. Again, this could be a half-day lecture. This could also be a morning lecture, afternoon workshop / panel alongside my sister, Dr. Elizabeth Sanders. With that, I want to thank you so much for considering me, Katrina Sanders, for your meeting. Although this short video walked through just a tiny little blip of a course you might be considering, please do know that my team is always readily available to answer any other specific questions that you may have. It is truly a pleasure and an honor to be considered, and I hope you'll reach out if we can answer any other questions for you. Thank you so much, and I hope you have a beautiful day. Thank you.